Hello, everyone, and welcome to AfyaDirect, our health solution in hypertension. With AfyaDirect, your health is in your hands. AfyaDirect is an AI powered SMS health education and monitoring service. Let's look at a case study. Mzee Kamau is a 66-year-old farmer in a remote village in central Kenya. He's always been strong and healthy. 3 years ago, while out on the farm, he started feeling dizzy. A while later, could barely move his right leg and right arm. His son, who was close by, noticed that he wasn't acting like himself, and Kamau's speech was different. He quickly alerted the neighbors and rushed him to a local hospital. Upon arrival, he was informed that his blood pressure was 246 over 112 and that he was probably having a stroke. I didn't have a good understanding of my condition and I don't know when to go for a checkup. But I take my medication only when I'm not feeling well, said Mzee Kamau. Unfortunately, Mzee Kamau's case is not a singular case. According to the World Health Organization, 1.2 billion people globally are expected to have hypertension by 2025. Out of them, 74.7 million people currently live with hypertension in sub Saharan Africa, and that number is expected to rise to 125.5 million by 2025. Did you know that 24% of adults living in Kenya have hypertension and that only 46% of them have it diagnosed? Or 46% of them are undiagnosed, sorry. And that hypertension carries with it a 1.7% mortality rate in Kenya. So, just like the case of Mr. Kamau, there are many patients living with hypertension and who develop acute or chronic complications because they are not screened early. And if they are not screened early, they do not know how to manage the illness. With Afya Direct, we leave no one behind. Some of the healthcare barriers in rural Africa, which is our target, is lack of information about the condition, reduced access to healthcare professionals and centers, late disease detection, lack of reliable medical schedules, and lack of literacy and technology barriers facing some of the hypertension patients in rural Africa. With Afya Direct, we bring an AI powered SMS health education and monitoring service that is going to use USSD and SMS to deliver this particular health education and monitoring service to our end user. The Afya Direct features include a Medi library, which is an AI powered offline content library, a Medicon call, which is a swift personalized access to medical professional via call. We also can book a consultation through the software or service. You can be able to access an emergency line. Here you can get swift emergency line and using a simple SMS prompt, you can alert healthcare workers or professionals upon potential emergencies such as heart failure and stroke. You also have a medical or medication calendar. And lastly, a training center that enables caregivers, guardians, and family members to learn more about managing their particular disease or hypertension for patient. The technological requirements of our solution include a USSD platform or an SMS platform, an AI engine that is going to act as a chatbot between the user and the different resource people, a secure database that is going to store the user's information, and a content library where accurate, locally relevant health information is going to be placed and accessible to the user. The market breakdown. Currently in the Kenyan market, we have about 4 million people between the ages of 25 and 65 years who are potentially living with hypertension. Out of them, 1.9 million of those particular people have hypertension undiagnosed. Our mission is that by 2030, we will have been able to reach at least 600,000 adults living with hypertension in Kenya to help them manage and control their condition. Now, what is the competition that we face? Currently in the market, there's another software called AfyaRecord that is currently offering more or less the same service that we provide. only that their software requires technological skills as opposed to ours, and their particular solution requires stable internet as opposed to ours, which works with or without the internet. So this enables us to reach our end user in a more appropriate and accessible way. What have we been able to come up with within our business model to ensure sustainability for impact? First and foremost, we have created a low cost of subscription where we have created a subscription cost of $0.5 per user per month. We've also thought about strategic partnerships where you can partner with mobile network operators to increase our revenue streams. We've also thought about government support where we can liaise with NGO and government subsidies for extra reach. And we've also thought about a smart village, which is a partnership with local stakeholders to establish a network of trained community caregivers and health workers. Finally, we have also provided a platform for premium tele services or telemedicine services to occur, where if someone has an emergency, they can get healthcare services through their mobile device. We believe in keeping it simple so that we can keep the service very affordable to maximize the impact. Our financials are as follows. Within the first year, we expect a business cost of about $105,000, which is going to be compared against our target of 5,000 users, who, if we each get $0.5 from per month for the whole year, we'll be able to get approximately $30,000. And we anticipate about some grants of about $20,000 to get our revenue within the first year to about $50,000. Within the second year, we anticipate that our costs are going to go up from $105,000 to about $130,000 as we scale up, but also our revenue is going to grow from $50,000 as we get 50,000 users who all, each pay $0.5 per month. We are going to get about 50,000 times it's about $300,000 and a telco fee of $1 per user annually. So that's about 350 to $360,000 within the second year, which means that we'll have broken even. Within the third year, we expect to undergo heavy expansion, targeting 100,000 users, and then within year four, target 150,000 users. Remember, our goal is to get to 600,000 users by 2030, which is year six. So essentially, we'll be on the right track. So that year five, we target 300,000 users, and year six, 600,000 users. So that's our particular projections, and you can be able to see even the financial projections there. Now, the projected impact, we anticipate being able to reduce the mortality rate of hypertension in Kenya by 50% or halving it once this particular solution is effective. We also anticipate that the number of deaths that could be prevented annually if our solution is effective could go up to 102,000, and this particular solution could be able to ramp up an annual recurrent revenue of $4.2 million every year by 2030 if it's able to accomplish its mission. Our implementation strategy will involve platform development, content creation, pilot launch, and local partnerships within the first 1 year. So within the first 1 year, we're focusing on pilot testing. Within the second year, we are focused on data-driven model refinement, breaking even, and stabilization, which means we're looking for local partnerships and we are stabilizing and expanding. And then lastly, within the third year and beyond, we are looking at expansion based on our pilot outcomes and funding. And here we looked at localizing the content and making it accessible to a greater audience. Lastly, our team involves or includes Michael Owino, who is a clinical pathologist, Na Francisca, who's a biochemist, Job Ngicho, who's a physicist, Mary, who's a medicine professional and also a data science specialist, and Jonathan Thu, who I am a business specialist and a marketer. Now, for any questions, you can reach out to us via the email provided or through our contact details. Thank you for listening to Afya Direct. Afya Direct is your health in your hands. Thank you.